Number one, always. Invicta 98.9. Be victorious. Be victorious. Be victorious.
7 o'clock.
It happens here. Wura, FA Cup, and Premier League reconnect to DSTV.
7 o'clock.
Stay in. Enjoy Wura on Africa Magic, football, and more. Reconnect to GoTV.
All right, good evening, people of God. How are you doing? How is everyone doing? Husband, wife, children. I hope everyone is doing well. And happy Trinity Sunday to all of you who celebrate it. Indeed, it is a concept, it's a phenomenon that if it is not given to you by the Holy Spirit, you cannot understand. And I'm sorry for that. But for those who have not seen but yet believe, your blessing is there already. At least that one you know is for sure, because the Savior himself said it from his very mouth, that blessed are those who have not seen but yet they believe. All right, so good evening to everyone. How is everyone doing? My name is Jacquelyne Adebija, and the program is Marriage Keys. Now, last week I did tell you that because of the many challenges that we had people send in, messages on, we just thought it would be nice to have a medical professional come to talk to us. Now, quickly, I want to thank the person who has reached out to me already about a psychologist. I just realized that the text message I sent to you bounced back. You know how the network is these days. So I just realized that. And after the program, I'll be sending you another text message. Thank you so much for reaching out. I appreciate you. Then I would also like to thank Dr. Paul Dogo and Reverend ADEJO, who were able to get Dr. SOGFA, a consultant urologist, for me. It's not easy to get them into the if you know what it means to get a consultant urologist, you'll know that this was no easy feat. And I'm saying this to appreciate him, to appreciate Dr. Paul Dogo and Reverend ADEJO, but also so that you understand that this is a rare opportunity that we have here. And so right off the bat, I would like for you to start to send in questions that you might have. We're live on Facebook, we're live on YouTube. You could go anywhere there and drop your comments. Drop your comments and I'll take them as I see them. You can also send WhatsApp messages to me on the number 090-7270-3270. Don't send a text message because I will not see the device that takes that. I forgot it. So I forgot it at home and I apologize for that. So you can only send me a WhatsApp on that particular number. Okay, so once again, Dr. SOGFA, you're welcome. Thank you for making out time to be with us this evening. Good evening.
Thank you, Jacquelyne. Thank you, Reverend ADEJO.
We should be thanking you,
Thank you.
for making our time. We actually really appreciate you.
Yes.
All right, so we're going to be delving into this with the Reverend because he will be helping us, through the spiritual and physical aspect. And of course, even some of the complaints that he has had, in his office and time in counseling, we'll try to go through those things. Now, one of the first things that I know time and again I've heard causing challenges in a Christian marriage is erectile dysfunction. So my first question is about erectile dysfunction, and I am directing it at you, Dr. Sofa. At what point will someone say, indeed, this is a situation that is termed erectile dysfunction? And at what point are you saying, no, you cannot say this person has erectile dysfunction just yet? So I guess what I'm asking is, how do you define erectile dysfunction, and what are the many factors that lead up to it?
Okay, thank you for the question, and good evening once more to all the listeners. Erectile dysfunction is actually a pertinent issue, and generally it's defined, or medically it's defined as a persistent or repeated inability of a man to achieve erection long enough for satisfactory sexual intercourse. So the key point there is that it should be long enough, and then there should be satisfactory sexual intercourse. But it's not just a one-off thing or once in a while thing, but repeated. Once it occurs frequently, then one can be defined as having erectile dysfunction.
What do you mean by frequently? Like in a week? Say a couple tried to have intercourse like 3 times in the past week, and those 3 times the man was unable to, maintain his erection. Would you now define it as ED or erectile dysfunction, or are we looking at a more prolonged time?
Yes, if one tries consecutively 3 different occasions, at least a day apart, and it's the same outcome, yes, it qualifies as definition. This we said repeatedly because it's not you try this, it fails, the next time it succeeds, and then after that it fails. Then it may not really be a persistent one. But if each time you've tried 2, 3 times more, yes, it can be defined as erectile dysfunction. That's if there's sufficient time in between attempts, because you can't try 3 times in a day and conclude that yes, no, that's the same circumstance that would have caused the first one is likely still there. So you have to give enough time in between attempts, and then if it recurs 3 times or more, then one can say yes, there is a problem.
Reverend,
Yeah.
Part of the problem around issues that affect sexual and reproductive health in men in Christian marriages is the, should I call it shame, or there's a certain kind of reticence in discussing it. As a matter of fact, when it happens between husband and wife, the wife tries to pretend like, it's no big deal, and the man is pretending like this is just, but we just heard from a consultant that if this happens, like the same thing happening even in a week, we can actually say that this person is faced with erectile dysfunction. How should, between a husband and wife, how do you go about this kind of discussion? In your years of counseling, would you say that you address that situation immediately as it happens? I mean, the man, for instance, now the man just realizes, look, we can't have sex. It's not responding the way I want it to respond. Should you have that discussion on the bed as pillow talk at that time, or would you say it's not wise to have that discussion at that time?
It is proper for that type of discussion to take place immediately. If you know it has happened once and the second time is happening again. Now, most of the time, why such things happen, according to some that have told me their matter, they told me that when it is time for Congress, the woman will begin to frown. And that has a lot of psychological effect upon the man, because it is business that must be taken in a passionate manner, not in a harsh atmosphere. That can affect erectile dysfunction that we are talking about. Why I say so is this. A man thought that he has erectile dysfunction, and he went and got hold of some enhancers. And then when he took it, it was overreach. Which means without it, he could have been able to go through this without having to add any helper. And that can affect the heart of the man and lead to death. Let me not talk too much.
No, so still on you, Reverend.
Okay.
Do you not think that having a discussion as, do I use the word delicate as this, at that point when the man is already feeling, I don't know, I'm trying to find the correct words to use here. Is it shame should I use,
think,
or,
yeah,
you know, he's already feeling emasculated because he's unable to perform. Do you really think that that's the best time to actually have that kind of discussion?
You see, wife and husband should be friends. They shouldn't hide anything from one the other, so that if anything is happening to one, they should be able to bring it to the fore, so that they can discuss it, and in case if it persists, they will know where to go. So it's not a shameful thing to discuss it, because the earlier you tackle such a thing, the better.
The earlier, the better. Dr. Sofa, you agree that the earlier, the better? Is this a situation where you should present to the hospital as early as possible? Is it one of those medical cases where you will say the earlier you see your doctor, the better? Or whatever time you decide to see your doctor, I mean, the result will still be the same?
Yes, the earlier, the better. But I would like to also just backtrack a little and say a lot of these causes. And if we look at these things, sometimes we can even handle them at home.
Yeah. Oh, really?
And correct these things without any need to come to the hospital. Yes, Reverend was talking about the psychological aspect. It will surprise you it may not, surprise you to know that about 50% of erectile dysfunction, the cause, is psychological. Yeah. In 50% of cases.
That's that's half.
Half. You know, so you just have another 40. In fact, in 40 of the remaining 50, there is also a psychological contribution. So you find out that in about 90% of erectile dysfunction, there is a psychological component. Yeah. In 50% about that, it's the sole reason. In another 40%, it contributes with another reason. It's only about 10% of cases that we have what we call the organic erectile dysfunction. So generally, medically, we have we classify it broadly into three.
Okay.
The psychogenic erectile dysfunction, then the organic erectile dysfunction, and then the mixed. That's one that combines both organic and psychological. So you find out that the psychological components can contribute in as much as 90%, contribute partly or wholly. So what are these psychological things we're talking about? Discord between couple. If a man is not happy with his wife, he is not physically attracted to her at all. No matter how beautiful, no matter how she presents us, no matter what happens, that strain between couple will not make him have that physical attraction to be aroused. Because a man, generally in erection, as we talk about in medicine, is controlled by a part of the nervous system which we call the parasympathetic nervous system. And the parasympathetic nervous system is that part that works when you are relaxed, as opposed to the sympathetic when you're tense, you're afraid, you're anxious, you know. And they are counter regulatory. Once the sympathetic takes effect, it suppresses the parasympathetic. So if you have any anxiety, any fears, any worries, and that worry could be from your partner, as much as the woman harping on the man, oh, you didn't do well last time, what's the guarantee that you're going to do? And then the man is anxious, he's worried, it worsens the situation. As opposed to a woman that says to her man, okay, fine, I understand, maybe if we calm down, we could try again, it may be successful next time, and the man is calm. You might find that, in fact, so that's why I said a lot of these things can actually even be solved by the bed with the couple discussing amongst themselves. It's only the one that has to do with some pathology, some actual things going wrong, that yes, you need to come to the hospital and things will be looked at, and what can be done will be done. I'll need to also add that oftentimes one of the challenges I have is that when the individual comes to the hospital, you find out it's often most times just the man that comes alone. So I don't get to even tell the wife these things I just mentioned. You find out, so sometimes I say, okay, come with her. Then other times, it's even the woman that comes to the hospital and complains. She said she's trying to get the man to come, and he doesn't want to come. Yeah, so it goes both ways. But because I see majorly men, that's what happens when the men come.
Okay, so you are saying, doctor, that in a case like this, you would rather that when a man is coming to consult with you, that he comes with the wife.
Exactly.
Okay, so I'm sure our families are listening. Men, when you're going for a thing like that, don't say you want to go and chest it on your own. Please try and get your wife to come along so that some psychological aid could also be administered. Still on you, Doc. So when we are talking about organic erectile dysfunctions, meaning this has little or nothing, or at least, like you said, many times is mixed. Yeah. There's always that psychological aspect to it. But in organic erectile dysfunctions or the mixed, what are some of the most common culprits, causes of erectile dysfunction?
Chief among them is diabetes mellitus, diabetes, elevated blood sugar, prolonged elevation of blood sugar. Hypertension contributes. There are other conditions, medical, like hypercholesterolemia, that can lead also to some atherosclerosis, that's thickening of the arteries. Okay. Generally, any condition that affects either the blood vessels or the nerves. Now, just briefly, diabetes does this by harming the nerves. Over a long time, high blood sugar destroys the nerves that carry these impulses to the nerves that control erection. Hypertension, it contributes by damaging the blood vessels, because erection is increased blood flow to the male organ. Once there's that increased blood flow, then the erection can happen. But if there's hypertension that has destroyed the blood vessels and stiffened them over a long period of time, you find out that these blood vessels cannot expand to take the increased flow of blood. That can contribute to that. Then similar things happen with high blood cholesterol and some other conditions that can affect the blood vessel and nerves. But chief among these, diabetes, hypertension, and then drugs. There are a couple of drugs that we take that can affect a man's ability to function. There are some antihypertensive drugs that do that. Things like Aldomet, so that's why we don't like giving men Aldomet. There are a couple of other drugs that can. There are drugs that reduce the testosterone in the body of a man. Okay, they can also cause that. So generally, but chief among them, diabetes, hypertension, are the main culprits.
Are the main culprits.
And some medication.
All right, so I'm just going to quickly start because I had to curate some of the situations that we've had that people have called. There's a woman who sent a text message to me and talked about the fact that when she married her husband's penis or genital there was no problem with it, but that recently, in recent years, it has developed a curvature that she's seen, and it's kind of hurting when they have intercourse. What could be the cause of this? Is this a medical condition or a sexually transmitted disease that has caused this?
Okay, it's a medical condition. If I get what she's talking about, well, it's we call it Peyronie's disease.
Okay.
Yes, Peyronie's disease. For those that want to read about it, Peyronie. Now, it's a condition that can happen, not typically for every man, but it's one of the risk factors are that there are men that easily form scars. So essentially, it's a scar forming within the penis. And if a man palpate, okay, sorry, I'm using medical. If a man feels, if a man feels, he may feel a thickening on
the shaft
of the of the organ, and
even when it's flaccid.
Yes,
okay.
In fact, when it's flaccid, that's when he will best feel the thickening.
Okay.
If that is there, then it's likely the Peyronie's disease, and that's likely what's causing the curvature. And if it doesn't affect intercourse, it's usually not a problem.
No, she's saying that it's causing pain.
Yes, she said it's
now.
causing pain for
her.
So,
yes.
It's something that can be corrected surgically.
Okay.
Even though recurrence can still occur, because it's a difficult thing to treat actually.
What causes the scarring in the first place?
Micro trauma over a long period of time. During intercourse, it's a physical activity. Mm-hmm. So that hits that, there's one injury, a little injury, just a little, the trauma of intercourse, it's bent and all that. So as healing occurs, as it occurs with everybody, once there's healing, there's deposits of fibrous tissue. That fibrous tissue that is continually being deposited forms that plaque. And for men that are predisposed to developing it, it's a progressive thing. So the fibrous tissue begets more fibrous tissue, and it begins to contract, and that part where the contraction occurs progressively leads to the bending of the penis in that direction.
It's like
it's pulling the penis towards the plaque, and then as it bends, so when the curvature is quite significant, it can cause pain even to the man. In fact, some it makes penetration impossible.
Difficult.
Yes, and in those kind of cases, it can be treated. Surgical treatment is required. But
massage cannot help.
Massage alone, no. There are some medications we do use, topical medications that can be applied together with a massage. The outcome, not so good, but fair, okay? So when it's not severe, we do that, and sometimes there are even injections that are given on the plaque to make it softer and then release it over time. Outcome not so good. Yeah, it's a difficult thing to treat, but yes.
So would you advise that for couples who love to have rough congress, we call it congress here because of kids that might be listening, but would you advise that people be more careful with that? Because you just talked about microaggressions on the penis, and I'm wondering what could cause microaggressions if not like rough sex, really?
Well, I think the most important factor is being predisposed. It's not for every person. It's for individuals,
people who have that
likelihood of forming those scars. And typically, whatever they do, as long as those micro trauma, and the truth is the body endures a lot of strain. It's a physical activity. There's really not much one can do about it. Whether it's rough, not so rough, it's still going to have
people
that
who will develop
micro-trauma.
things like that will
Yeah,
develop
they will
it.
develop as long as they have intercourse.
Oh, okay. Reverend, you want to talk about, have you come across
I've
something
not.
in like that? Okay.
No,
So someone has sent that in. All right. So someone else is asking here that her husband, after his prostate surgery, there was the finding out that there was some cancer cells, and so the doctor advised that he should also have an orchidectomy. And so since then, sex hasn't been the same. As a matter of fact, sex has been non-existent. The man, okay, this is even from a man. He is saying, what can he do? Even though my wife says it is fine, but I do feel less than a man. Is there any medical help for this? And how do I talk to her about it? All right, so let's go on this commercial break. And when we get back, we'll be talking to you. Many thanks once again to Dr. Paul Dogo. I didn't mention that Dr. Paul Dogo is a former commissioner for health in Kaduna State. So plenty thanks to you, sir, for helping us drag in Dr. SOGFA Dominic this evening. His mentor, his guy, he says. So it's not something I could have done myself. So I'm really grateful, sir, and of course to Reverend Joe Adejo. We'll be right back. Today we're talking everything sexual and reproductive health as it affects men in Christian marriages. We'll be right back.
We'll be right back after this quick commercial break.
Are you serious? For real, are you serious? Invicta FM.
Ku yi tunanin gida, inda uwa ke da lokacin karanta wa ɗanta littafi, yayin da wani yaron kuma yake wasan gina gida a gefenta. Babu hantara, babu gaggawa, sai zunzurutun soyayya da ta ninku sakamakon samun lokaci. Wannan shine damar da tazarar haihuwa ke bayarwa, wato dama ta gani da sauraro. Kuma a irin wannan yanayi ne yara suke bunƙasa.
Ziyarci cibiyar lafiya mafi kusa domin farawa ko a kira lambar waya 222 wannan sako ne daga ma'aikatar lafiya tare da tallafin gamayyar kungiyoyin ADEJO da FEM.
Oh yeah now, time to run your money correct. Download Bill Station for iPhone and Android, no dolly, or waka go to billstation.com, sharp. Bills, transfer, everything day one place.
Make you get rewarded instanta when you use the referral code BISAN. BISAN. When you download the Bill Station app, make you enjoy exclusive bonuses plus cash prizes wey fit reach up to 5K. No dolly, make you download now.
Bill Station, money no go stress you again.
My friend, time na money.
So it's Sunday.
It's your fun day
With Jesus. With the living God.
with Jesus.
Invicta 98.9 FM.
All right, welcome back from that commercial timeout. You're listening to Marriage Keys, only on Invicta 98.9 FM Kaduna. And with me in the studio, I have a consultant urologist, Dr. SOGFA, Dr. DOMINIC SOGFA, and Reverend Joe Adejo. They're men, and we're talking men issues today. We want to take all your questions that you were too embarrassed to ask your doctor, And whatever it is that you're confused about, whether male or female, you can start. And of course, very soon I would like to open up the phone line so that people can have direct access to the doctor and speak with him. So, but the question I asked before we went on that break, doctor, a man who's had a prostatectomy, that's prostate surgery, his prostate has been removed, his testes, because I had to confirm that from you. What does orchidectomy mean? It means that the testes have been removed, and this just basically means a castration. A man like that cannot have children anymore because everything that could produce spermatozoa have been removed. Now, how do you advise that they go about their sexual lives, because they're still human and he has a wife? So how do they go about the issues around libido and desire? Can Viagra okay, I'm not advertising for them, but can such drugs help a couple like that, Dr. Sofa?
Yes, thank you for the question. Now, there are a couple of things we consider, and that's the brain cracking that goes on with the doctor. Okay, because as you treat an individual, you don't just treat the disease, you treat the person as a whole. And a person that is healthy and unhappy is still not healthy, if you allow me to say that. Yes. So, oftentimes we consider the issues of Congress at home with family. Now, orchidectomy, what it does chiefly, aside the treatment, it's a form of treatment for cancer of the prostate, a type of cancer of the prostate, or a stage. Yes, so that aside, because that's not what we're talking about. But once it's done, the testosterone level of the individual comes down. And that is the desire. That is what is desired for the procedure.
Okay, so just to be clear, testosterone, that hormone in men, is what actually makes desire, that brings libido in a man.
Yes.
Okay.
Yes.
All right.
Yes.
Okay.
It's a chief contributor in libido.
Okay.
In men.
Okay.
However, it doesn't play a direct role in erection.
It does not play a direct role.
Which means the desire may be there, and there's no effect.
No, that means if in the absence of testosterone, a man can still have a normal erection and intercourse.
How so?
Yeah, what testosterone does, if you understand the way a man is stimulated is either by sight, centrally, either by sight, by thought, that's central, or by touch, tactile. So any of these can actually still stimulate a man. However, in men with low testosterone, that central stimulation is significantly reduced. Okay. However,
when you say central stimulation, what do you mean?
Central nervous system.
Okay.
Brain.
Okay.
Yes, the one that comes from the brain.
Okay, so it has
either
to
by
be
thought, by sight.
Right.
Yeah, it's quite
significantly
low.
low. So it has to come from tactile.
Yeah, tactile is still better. It can still happen. I said it's just low. Just that they have maybe, if you permit me to use the word, a higher threshold for stimulation. So it's not easy. Libido is low. The not natural desire of a man to have sex is significantly lowered in them because of the low testosterone.
Okay.
But if they are able to have it, they can have a normal erection and normal congress.
So what you're saying, just so that our listeners understand, is that if a wife would take out time to actually play with her husband, play with his genitals or whatever, even a man like that could actually have an erection.
Yes.
How stiff an erection? Are we talking about just
soft or
a soft or like before? Can it ever be like before?
Like before. When we say before, for appropriate for the man's age and physical condition, health condition, yes, it can be. However, most of those men still have some erection.
Okay.
And if they still do have some of those, then it means that medication like sildenafil, which you mentioned earlier on, tadalafil, which we commonly use, may still be helpful to those men. Because once there's some erection, those medications can kick in to help. So if you see your doctor, the doctor will reassess and confirm that that is present, and then those medications can help. Suffice to say at this point, if there is completely no erection, those drugs do not work.
They do not work.
They do not work. They act only when there's an erection, and that's why some men actually come and are afraid. Oh, doctor, you're writing this drug for me. What if it causes me to have an erection and I'm not ready to have intercourse? I said, no. If you don't have an erection, it will not initiate an erection. It will only come in to make the erection stronger and longer.
Okay.
It doesn't initiate the erection.
Okay. So, Reverend, I'm going to ask you a very controversial question that we have actually talked about here today.
Okay.
But in a situation like this person who has written, the husband having had, almost everything, in that area removed, and having problems with erections, would you advise sex toys for the use of? Is it something that spiritually aligns a Christian with their faith?
No, sex toy will not even do as much as when there is excitement within the man and the wife when they are together. This excitement I'm talking about has great role. There are things I wouldn't like to mention here so that nobody will begin to go practice outside. Excitement. Look, when there is hatred, when there is bitterness, these things we are talking about get worsened.
There's also fear.
And then anxiety, yes.
Yes, and anxiety.
So when the Bible says in the book of Proverbs chapter 14 verse 30, it says, a sound mind is the life of the flesh. A sound mind is a mind that is devoid of hatred, bitterness, resentment. All those things can, even the normal man, it can kill your libido. All right? But when there is joy, joy brings about miracle. All right? That's why when you pray and you have faith that certain thing will happen, and then the people you pray for who have this type of thing and they are happy to receive it, you will see miracle. Well, even doctors cannot explain it. Yeah.
Dr. Sofa just chuckled. All right. It's because, the reason why I asked you, Reverend, is because there's so many types of toys out there these days, not to even hold brief for any one of them. But there are some that, how do I put this? Help, in quote, I'm using this in quote now, help the erection. There are those that help the erection. Now, doctor, I don't know whether you've seen these rings that come to the base of the penis and they constrict, they kind of, is like rubber band, like a thick rubber band that goes to the base and helps it stand stronger. Is it something that already Reverend has said is not aligned, and I think it's
if it is a prescription by the doctor, I think
it's
allowable.
I don't know if you prescribe things like that. Do you prescribe things like that?
Yes, it's one of the options of treatment. I don't think penile rings.
That's what they call them.
I don't think they qualify as sex toys.
Okay.
Those are therapeutic.
Okay, so that's
for
my
a man
bad.
that is unable to have, there is a way we use it commonly sometimes with vacuum suction.
Yes.
Sometimes the suction is applied to pull the blood into this thing, then the ring is applied to maintain the erection.
Okay.
Yes.
So I didn't know that it's something that is medically, actually, because I've seen these pictures. People have sent all sorts to me. So I have actually seen them, and they are classified under sex toys. So it is good. No, it is good that we now know that you actually prescribe things like that. You see why it's good to go and see a urologist?
Yeah.
It's good to see a urologist, our men, because things like this come out. I didn't know that this could be actually prescribed medically.
Yeah.
All right. Yes, Reverend.
There is this pertinent questions I've received from 1, 2, 3 women. I and their complaints were just the same. It is like this. He said, look, my husband can be on me oscillating, that is stroking, continually for almost 30 minutes. And when eventually, so both of them told me, say whether they are pretending to have reached the moment of most pleasure, they don't know. Because after it all, nothing is coming out.
Okay.
No semen.
Okay.
So
yes, I was even going to ask you, doctor, for a man like that who has had that operation, will there still be any ejaculate? Would anything come out? Will the man still feel pleasure?
Yes, you're talking of the okidectomy?
Yes.
Yes, of course.
He will still feel pleasure.
But this one didn't go through operation.
But nothing comes out.
What Reverend is talking about is different
from
what you're asking.
Yeah. Okay.
Yes. So let me start with answering your question first. Yes, the man will still have pleasure. He still have, like I said, he may have even normal erection and intercourse and ejaculate. It's just that there will be no sperm cells.
Yeah.
The ejaculate that comes out of a man comes from different sources. There's a contribution from the testes. There's a contribution from the seminal vesicles. There's a contribution from the prostate. All these secretes the fluids together in what comes out. In fact, the contribution from the testes is the least in volume. Is the least, but that's the one that contains the sperm cells.
Right.
Okay, from the seminal vesicles and from the prostate, much more, and then they come together and is
so. But in this case, where the prostate has been removed and the testes have been removed.
Yes. Now it depends on the type of surgery he had. Okay. I don't want to go into too much details, but there are several types of surgeries. There's the one that you partly remove the prostate. There's a type that you remove the whole prostate. And then if you do the type that you remove the whole prostate together with the seminal vesicles, it's removed. So you have minimal ejaculation. And then there are men. Normally they're normal, but they're on some medications, maybe for prostate enlargement. And at the point of ejaculation, they have what we call retrograde ejaculation. Instead of the semen coming out, it goes into the bladder. So he's dry. The man, nothing comes out.
Yeah.
But he has actually had an ejaculation. But it has gone into the bladder. Typically for those on those medications or those that have had prostate surgery, whether for cancer or not for cancer, they can have that kind of retrograde ejaculation.
Is it harmful?
No. No, in fact, and that's why if one is still planning on having children, we counsel the person not to have prostate surgery. But if one has completed his family size, then he can go. So it's other than the inability, or not really inability, difficult, because that sperm that has ejaculated into the bladder can still be retrieved and used to fertilize the woman.
The urine in the bladder would not kill it?
No. No, it won't. Sometimes you give them the person some things to take to alkalinize the urine and make the environment of the urine friendly for the sperm, so that when the retrograde ejaculation happens, the person can just pee out. You take the sperm cells from the urine and then use it to fertilize the woman. So it's not that it just makes it more difficult.
Okay.
And all that. But they can still have children.
Okay. So in cases like what Reverend was talking about, if it's not affecting their sex life in any way, would you still advise that men like that see you?
Yes. What Reverend described is close to what we call anorgasmia. It's a poorly understood part of medicine. Some people just find it difficult to reach orgasm. So they could go long and tired and even just
and
stop.
The woman is tired.
Especially, yes. If it's the woman, she's tired, she just wants the man to come and
go.
He doesn't get there. So he doesn't get to that peak. And sometimes it's the woman, anorgasmia. However long the man goes, she still doesn't. It's a difficult thing. It exists. Difficult to treat, not because it's poorly understood even amongst us, but it does exist, and it's not a palatable thing for
it's not.
It's not.
Because when you hear these women talk, I don't know.
So they become averse even to sex. Once your husband wants
It's
to
coming.
meet them, they just think of
They are saying,
yes.
oh, their heart is.
And let me just throw this. I'm sure it's going to shock a lot of our listeners. The normal time once a man achieves penetration is 3 minutes. Any man that is able to stay 3 minutes
is normal
from point of penetration to ejaculation.
It's normal.
Yeah.
3 minutes.
3 minutes. That's
and so when
standard.
we hear men
stories, so you hear stories, and so men begin to gauge themselves against the stories. I've had, in fact, quite recently, I've had people that after talking with them in clinic, I ended up telling them, "You're fine," but you see them reluctantly standing up. I say, "You want me to tell you you're sick, but you're not." Say, "Hey, doctor," but I say, "You're fine. You're good." They say, "Oh, doctor," but I say, "Yes, what else do you want me to tell you? This is it, this is that." So, and it's because they've had a lot of things and they expect to meet up with those things. Yes, there are
expectations that are not real. And many of them come from years, especially the early years of watching porn, watching unrealistic sex going on in movies and all of that. So you get this idea, oh, I must go for 1 hour, I must go for 30 minutes and all of that to be able to be considered a man worth, yes.
I think I can explain some of these things for people to, there are people who think they are not adequate. I think from this point, I can explain to them. There was a time somebody came to me and said, "Look, I really hit her today." I said, "What happened?" He said, "For 12 minutes. I said, "That is not sex." And he was looking at me. I said, 12 minutes you are stroking continually? He said, "Yes." I said, "No, that is not." I said, "Look, when we talk about Congress, the foreplay are the time we add. The foreplay, that is the time we add.
Yes.
And not the time you have already gained entry. And then immediately you begin to stroke, just like he said. 2-3 minutes, I think.
It's good enough.
The moment of most pleasure is achieved, and then that's okay.
Okay, go ahead, please, Doc.
Yes, agreed. There are some differences, especially some women may delay in reaching the climax and all that. So sometimes there are some maneuvers, there are things we teach men to do.
To hold back.
Yeah, to hold back, withdraw and continue. All those things just to
so that
prolong this thing, especially if the woman had been complaining prior that she doesn't get
3 minutes is not enough.
Yes.
All right. Okay. Someone is asking, does age affect erection? And if so, at what age? I have this from our WhatsApp. I do not have a name, but does old age, affect erection in men? And if yes, at what age? All right. Doc, you want to answer that before I go to answer the phone calls? Go ahead.
Before the doctor confirm.
Okay.
I think age does not affect it so much if you are healthy.
Really?
Yes. If you are healthy, your heart
hear from you, Dr. Sofa, because what I know from scientific books is that there is no way your erection can be at this age. You're over 70 for your erection to be as hard as it was at 30.
Do you know what?
No, I'm just saying that scientifically. I'm just saying. I'm not doubting you, but I'm just saying.
Do you know what?
Yes.
The way you look, the way you relate with your wife, the excitement that exists, the desire that both of you build. Look, what slows a man down is the disposition of the woman. Once the woman begins to feel not satisfied, the man also will begin to feel low. Because the words that come from the wife to the man is very, very crucial. It can finish the man completely. All right? That the man will even be afraid to even tell the woman, "Look, let us have this thing." So, but if everything is normal, the man is healthy, and the heart is beating correctly, and the blood is flowing. Go and ask Abraham. You remember Abraham?
Dr. Sofa, let's continue as a medical professional, taking it from that axis. Yes.
Of course, everything in the body changes as one advances in age. Yes. There is some effect of age on erection. The most prominent is what we call the refractory period, and that's the period between one congress and the next.
Okay.
Yes.
As you get older, that time gets longer. You could find men that could congress with their wives, young men, 2-3 times a day.
Yes.
As you get older, that time, in fact, it goes to a time that you may need a whole 24 hours to recover and be able to have
a whole week. Or a whole week.
But one time something is there.
Okay.
Yes, so that's that.
So, but what about the quality of the erection?
There is some.
Because, Reverend is working with Holy Spirit on this issue. I don't want women to have an unrealistic expectation.
Yes.
Right.
Yes. Now, aside that, the quality, there is some decline in quality. However, it's not as much as you would have in other areas. Yes. So it should be strong enough to have penetration and all that. However, of course, you can't compare the vitality and the strength as opposed, when you compare with
someone much younger.
Even for the same person when he was much younger. However, it's strong enough, hard enough to have penetration. So the reduction
give
in
pleasure.
Is, yes,
right.
It gives the pleasure and all that. Yes.
Okay. All right. So I just want to quickly acknowledge several people who have dropped comments for us. Samuel Olubio, Terso, Andrew Tengu, Gankato. Gankato says, my G. I think that's a friend of yours, Dr. Sofa. Victor Sule, good evening to you. Musa Emmanuel Abdul, good evening. Joshua Uzoma Rogu, Mary Love David, Joshua Bature, Eloy Abba, good evening. James Akubo, good evening to all of you. I do not see questions, that's why I'm just greeting everyone. Enalegu David Sule, good evening. Omolara Alayande, good evening to you. Musa Emmanuel, okay, good evening. Let me see if there's okay, he says that he has a question. This doctor is a urologist. This is for men. Next Sunday we will be having for women. So he is asking about a woman who dries up quickly. So this question you might want to ask me again next Sunday so that doctor is able to answer. But Dr. Sofa, you can answer if you want to. He talks about fluid in her dries quick and she cannot drive during the second round of Congress, yet the husband is ready to go for a third and even a fourth round of Congress because this is actually affecting the man mentally and physiologically. He has tried to talk to her, drive her to the topmost level of orgasm, but yet the situation still remains the same. What is the solution to this problem? So Dr. Sofa, if you want to, chip in on that, you can. Vera Audi, good evening to you. And Vincent Esther, I forgot, Happy Mother's Day. Happy Mother's Day. Please forgive me. Happy Mother's Day. I should have led with that too. Happy Mother's Day. Thank you so much, Vincent Esther, for reminding me. And good evening to you too, Henry Rest, Ayuba George, and Vincent Esther. Do you have a question again? I don't know. Lawrence Adubo, good evening. Benjamin Aderi Bigbe, good evening to you. How are you doing? And Benjamin says, all right, interesting topic. I think stress and worry in men has, beg your pardon, let me just quickly see this. Stress. Okay, the doctor should shed more light on low sperm count. All right. Then Benjamin says, I think stress and worry in men has been a major factor on the issue being discussed. And then Shade Margaret Jegede, good evening to you. I hope I got everyone because, like I said, I want to quickly open up the phone lines just to quickly check our WhatsApp. I think I got everything. Okay, Daniel from Narai is saying, my concern is how does one stop watching porn, and does porn affect erection? So I'm just going to divide those questions. I hope you remember, because professionally would like you to tell us if porn does affect erections. But Reverend, you should answer, how does one stop watching porn? I don't know. Well, just answer the question as you see fit. And then the person who is asking, Mr. Chiari, is asking for you to shed more light on low sperm count. So, Doc, low sperm count, does watching porn affect erection? And then the person who has a wife who is always quickly dry. Right. Go ahead, please, Doc.
Okay, so I'll take the first question first for the dryness. Yes, this best answered, of course, by gynecologist.
Okay, Doc, please, I'm being signaled. I beg your pardon that we're supposed to go on another commercial break. Okay. When we get back, you'll
continue. Please
don't lose your train of thought. We'll be right back. With me in the studio, Dr. DOMINIC SOGFA, a consultant urologist, and Reverend Joe ADEJO. We're looking at sexual and reproductive health challenges in men in Christian marriages. Stay with us. We'll be right back.
So it's Sunday.
It's your fun day.
With Jesus. With the living God.
With Jesus.
Invicta 98.9 FM.
Sun sale jajaye, amma gaskiyar magana ita ce addininmu yana karfafa kula da lafiyar uwa da tarbiyyar yara cikin nutsuwa da jin kai. Ai tun da yin tazara haihuwa yana taimakawa mace ta warke da kyau, lafiyar jikinta ta dawo sosai bayan haihuwar da ta yi a baya, har ta samu damar kulawa da yaranta cikin kwanciyar hankali. To wannan ba haramun bane, illa dai wannan wata hikima ce mai alfanu, kuma ba laifi bane idan mace ta nemi mafita. Addini baya son wahalar da kai, don haka kula da lafiyarki da tsara makomar iyalinki ibada ce.
Ziyarci cibiyar lafiya mafi kusa domin farawa, ko a kira lambar waya 222 wannan saƙo ne daga ma'aikatar lafiya tare da tallafin gamayyar ƙungiyoyin ADEPRONET da FEM.
Manufar da kyautuwar iyali, uba, 'ya'ya da ma'uwa.
Shin kun gaji da wahalar biyan kuɗaɗe kamar na katin wuta? Ai kuwa, a Bill Station ana iya yin hakan cikin daƙiƙa kaɗan. A biya ko aika kuɗi cikin sauƙi a ko'ina kuma a kowane lokaci. Ga sauƙi, sauri da tabbacin kariya. Bill Station, kuɗinku, manhajarku.
All right, thank you for staying with us. Still on the program, Marriage Keys with Dr. DOMINIC SOGFA, our consultant urologist in the house today, and Reverend Joe ADEJO. Yes, doctor, before we went on that break, you were saying, to answer those questions quickly before we open up the phone lines.
Okay. So I said, we're talking about the woman that is always dry. Yes. The cause of dryness and all that, best answered by a gynecologist. However, from the male point of view, there are lubricants that can be used.
Okay.
And I don't know whether to use the word the good thing or the solution. No, the good thing about intercourse for men is that even when the woman is not really in the mood, but she can still allow the man to have his way.
Yes.
And so with the lubricant and all that, the man can satisfy himself and life goes on. Yes, so I'll advise on that, but she should still see the gynecologist as to why women need to be aroused before they become wet. So That's not my field, so
you know, we'll talk to the gynecologist on that.
Yes.
And then quickly, Doc, if we're talking about lubricants, I hope people understand that Doc is talking about medical lubricants, because let's not go and start using palm oil, granola oil, or petroleum jelly, or one of those. I don't know. Doc, you want to say?
It might surprise you that there are some natural ones that we use that are quite good.
Oh, really?
Egg. Yes, it's even less toxic than a lot of the medical lubricants.
But what about the smell of the egg?
But it's not
fresh egg,
but it's natural, and it doesn't kill sperm cells. So most of the other commercial lubricants, yes, destroy the sperm cells. Many others that I use destroy the sperm cells. I'm not saying we should use the other ones.
Yes,
I've not studied them to know, but yes. However, there are other lubricants that are less toxic. But if the desire is to have
children,
yes, should try going without any. Okay, but
use the egg. The egg solution more likely.
It's better. But if you can go without any, it's best.
Is best.
But if it becomes necessary.
Okay. What about? Okay, please go ahead, Reverend. I wanted to.
You know, there was a time I was giving a talk, and I asked that men should be patient with their wife that are passing through menopause. Menopause means a change of life completely. So if a woman is passing through menopause, all those wetness we are talking about will be limited. It will be reduced. And once it is reduced, the woman will not have it easy at all. And a time comes when she will not even show interest. So the man has to spend longer time in order to get her to the point of having good congress. And then watching this pornography you're talking about. You see, when when a man sees a naked woman, you know what happens? The body triggers. Okay?
Yes.
If you do that 10 times a day, some medically, I think there's a medical way you can describe this thing. Okay? As you continue to watch it and you continue to trigger, it comes to a time that your ability to trigger will recline. Right?
Too much of everything is bad.
You get what I'm talking about?
I understand what you're talking about.
Yes. Doctor, you want to say?
Okay, still
yes, on this matter of pornography and its effect on erection.
On men,
Yes.
The problem with pornography, one of the problems, I'm sure there are other ones, is that because it's porn that arouses the man, when you're with your wife, she is not the same image you're seeing on porn. You may completely not even be arousable. And that is really, so you have young men that grew up watching porn. Even when they get married, it's difficult for them to be aroused by their wives, and that is the problem. Same man in the same way, if he goes back to pornography, you find out that he's arousable. So by the definition, with his wife he has erectile dysfunction, but in the real sense of it, it's psychological, because his psyche has been programmed with pornography.
Exactly.
So it is porn that gives him the stimulus to be able to, and he's unable to achieve that stimulus with his wife. The same thing with masturbation. It's a similar thing. If we find that if it's not that, being aroused will be difficult. And that's where the problem comes in.
Can a man's penis become desensitized to, because of the constant jerking with the hand during masturbation? Can a man become desensitized in those, in particular sensitive areas of the penis with the constant jerking of the hand?
Not really. Not really. Yes. There's no desensitization, except there's so much injury and the skin peels off.
Okay.
And all that. Other than that, no. it's still the same sensitivity. But like I mentioned, stimulus
Yes.
is usually either visual or sensory, and then goes in. Yes, there's a tactile component, that's the touching that can occur. So it's a combination of both. Oftentimes, it's a combination of both. Oftentimes, so if a man has gotten himself accustomed or so used to getting it, stimulated in any particular way, something else comes, it's quite difficult to switch over and that's really problem in so many marriages.
Okay, it's 5 minutes after the hour of 8, and it is time for me to open up the phone lines. Yes, I would like to open up the phone lines now so that you can ask those questions that you've been wanting to ask for a while. And the numbers are 081 40,000 989. Once again, that's 081 40,000 989 and 070 87 800 989. Once again, that's 070 87 800 989. Hello, good evening. Good evening. Can you hear me? Okay, let's do this. Hello, good evening.
I want to thank God for your resource person, the medical doctor.
Okay.
Urologist.
Yes.
And if you look at area of specialization has to do with urine, bladder.
No. A urologist is a doctor that not just urine alone, but everything, concerning the sexual and reproductive health of men.
Okay.
So it's not just
male sexuality.
Yes, it's everything about men.
So I want him to shed more light on low sperm count, because this has been a pain to some couples. Maybe they don't even know. It may delay them from giving birth. So I want him to shed more light, and how will men get to know that they are passing through this medical challenge, low sperm count. And then finally, the issue of menopause. I know it's a transition, but in human anatomy, there's a way a married woman needs to adjust when it comes to menopause as takes place. So I still want him to advise more and shed more light on this issue of menopause. Thank you very much.
Okay, and thank you too. All right, still taking your calls this evening on the issues of menopause. Doc, you will still talk about our issues today. All right, still taking your calls this evening. Hello, good evening.
Good evening, ma'am.
You're welcome. Go ahead, please.
Doctor, good evening.
Good evening.
I want to ask the doctor a question. If a woman has a gonorrhea, can he expect to have a trainer, or how long the thing can be for her body before he will have a trainer?
Before she will have what?
If a woman has a gonorrhea.
If a woman has gonorrhea.
Gonorrhea, yes.
Yes.
If it can destroy to get a trainer or not, that is what I want to know.
Sorry, sir. If a woman has gonorrhea, is it wrong to do what?
As to know whether if it have a trainer, if it conceive.
Whether she can get pregnant. With the gonorrhea or after she's been healed, cured. Okay, he didn't clarify if it's after she's been to the doctor and taken medications. Hello, good evening. Hello. All right, unfortunately that call got dropped. Still taking your calls this evening. Hello, good evening. Okay, so the calls are just... Hello, yes. Hello, good evening.
Hello, good evening, ma'am.
Yes, go ahead, sir.
Yes, sir. I really enjoyed the program you are doing this night. I want to ask, like, how many... I'm from Rigasa.
Okay, welcome, sir.
So I want to know how many times can man have fun, have congress with his wife in a month.
Okay.
And then what is the effect if you don't have it regularly?
Okay.
How old are you?
Thank you.
Okay, can you tell us your age, sir?
My age is 45.
Okay. All right. So how many times in a month, for instance, just an average? And what's the effect if you do not have as much congress as is usually recommended? That's all your questions, sir, right? Okay, and he's gone. Okay, so let me take one more and then I'll come back to you, Dr. SOGFA and Reverend. Hello, good evening. Good evening. We're connected. Okay, let's take this one then. Hello, good evening. We're connected. Good evening. It's too low. I can't hear you. It's too low. Let's answer some of the questions that they're. Sorry? Is it normal for a man to masturbate?
Yes, but
Are we a married man? Honestly, your line is not clear, but you're saying something about his wife. So I'm guessing please, if you can call back, please do, because we didn't get you. But let me come back before we forget some of the questions. Doc, do you remember?
Yeah, I remember.
Yes, please go ahead.
Okay. One about low sperm count.
Mm-hmm.
When we talk about, there are several issues with sperm that can happen with sperm. From weak sperm, then low sperm count, absent sperm completely, abnormalities of sperm morphology. So there are a lot of things that can happen to sperm. But if I just pick the low sperm count, if it's just low in number and every other thing, the morphology is fine, then it means it's fairly a treatable thing. It means that there's something that is causing the production of sperm to be low. So typically your doctor would order some investigations to try to identify what is causing the number to be low. And oftentimes when that is treated, it may be as little as infection. It may be as little as that. And if that is treated, the infection that is destroying the sperm cells is cleared, and then the number will pick up. Typically. Okay, it's when you have absent sperm and other things that it's a lot trickier to handle. For low sperm count, yes, it's easy. And then if it's low, it's just one sperm that is actually needed to fertilize an egg. If not for finances, with one, you can just go collect the sperm, use it to fertilize the woman, and achieve pregnancy. So it's just that it's quite expensive, but it's something that is doable as long as there are sperm cells.
What about the person who was asking about how many times a man should, an average, he said about 45, a 45-year-old man, how many times in a month would you say is an average for a healthy man? And is there any effect if a man falls below the average?
So there isn't a number. Now, congress between a man and a woman is determined by a couple of things. Aside the physical situation they may be in, even the individuals, you find out that there are people that by their nature want congress regularly. There are people that they are okay if they stay a week without congress, it's nothing. So if you have those couples and it's fine, it's not an issue. So there's really no problem if you stay without congress, if it's okay for both of you. Typically where the problem comes, if you have a woman, for instance, that likes congress regularly, and a man that it's not much for him, or you have the reverse, a man that likes congress regularly and a woman that it's really not, that's usually where we have the discordance and problems that will have to come in. This one has to trade something, the other one has to trade something, so that they meet in between and something is worked. But as long as both of you are fine, it's okay. Whether once a week, every day, 3 times a week, it's between the two of you, as long as there is no untoward effect. God has designed this body such that anything that is not used is recycled. So after some time, if it's not used, it gets dissolved and used to produce a new one.
So this thing that we hear that regular ejaculation actually helps to prevent prostate cancer. There's no truth to it, Doc, from what you're saying, or is there truth to it?
The National Association of Nigerian Urologists brought out a circular to that effect. You know, there are researches that have shown that are for and against that. And what we've come to say is that it's difficult to prove. It's difficult to prove. There are arguments. There are people, for instance, Reverend Fathers, that do not have, you don't see higher rate of prostate cancer among them. That's what you would have expected. You know, so it doesn't really hold water. But there are also people that have said, no, people that do this regularly. So it's inconclusive. As it is, there is no conclusive evidence to prove that. So as it is, until there is something that outrightly proves that, we would not go. We don't
comment on that.
We don't agree on that.
We don't agree. Okay. And this is for both in Nigeria and abroad. Because
yes.
Okay.
Yes.
What about the person who asked about the lady with gonorrhea, that kind of woman who's had gonorrhea? I'm assuming that he's talking about after she's been cured. Can she have babies?
Yes, she can. In fact, even if she still has the gonorrhea ongoing, she can still get pregnant and have children. Well, I must confess, it's not my area. It's gynecology.
Yes.
However, I manage men with gonorrhea. But importantly, the gonorrhea does more harm to men than to women. Yes. One of the causes, in fact, the chief of azoospermia, no sperm cells at all in the man, in the man's ejaculate, is gonorrhea. So you find out that this woman that carries gonorrhea can repeatedly infect her man. So the man gets the gonorrhea, and it can be asymptomatic in the woman. The woman can have gonorrhea and not have any symptoms.
You won't have any feeling that anything is wrong.
Yes. So
but
it's just
damages are going on.
So the man will go, get gonorrhea, treat it, come back, still pick and all that. So for the woman, she can have but even at the point of birth of the child, for a woman that has gonorrhea, there are severe infections that can affect the child. In fact, it can lead to blindness in the child. Yes, it can affect the child. So the woman may not feel anything, may not have any other untoward effect, but as she gives birth to the child has gonorrhea, and it can affect the child.
Oh, wow. So I go back to taking calls now. Hello, good evening.
Hello?
Yes, we're connected. Go ahead, please.
Good evening, Jacquelyne.
Good evening.
I appreciate Dr. SOGFA and for
yes.
It's actually very, very important.
All of a sudden, your line has just gone bad, sir. Please, can you call me back? I don't know why, but your line has gone bad. So I'll have to take another call. Hello, good evening.
Hello, good evening, Jacquelyne.
Yes, go ahead. You're welcome.
Yeah, good evening, Reverend. Good evening, Doctor.
God bless you.
My question is there any age limit for women to stay away from Congress? Because you discover that some women, after reaching some certain age, or maybe after giving birth to the number they want, they will tell you they are no more interested in Congress. And the man himself is really strong and he still needs. And then in some situations, we discover that the man, because of the nature of his Christianity or the religious, how the man is, may not like to go out, which is sinful. and so he will go for maybe masturbation. Then another question is, is it proper, and does it have any side effect in the life of a man for go for masturbation?
Okay.
So that is my question.
All right. And thank you very much. Indeed, a very important question, which is I'll be directing to you, Reverend. A man whose wife is recalcitrant, has not allowed him touch her. We know that he cannot force her because there's, the faith, the Christian faith also frowns upon that. And so if he resorts to relieving himself through masturbation, is this a sin? All right, so Reverend, please don't forget that question. Let's go take another question.
Okay.
Yes, hello, good evening.
Hello, good evening, Reverend Jacquelyne. I'm back.
Okay, go ahead.
Okay, I'm Reverend Adolphus Alidu.
You're welcome, sir.
Actually, what I wanted saying is, what is the place? It's a question before my little contribution. What is the place of diet in erectile dysfunction, in correcting erectile dysfunction? Because I want to believe what one feeds on has a way of really bringing life to someone, especially in the place of the man, before he is able to perform his conjugal right.
Okay.
Because I discovered that some may live in some certain kind of food that may not really bring about revitalizing that part of their body to make sure that men have that strength to mate with their wives.
Okay.
You understand?
Yes.
So that is another aspect. But one thing I got to discover when it comes to erectile dysfunction again, so most of the things I would have talked about, Reverend Joe and Dr. Shofa has really dealt on it. I discover so many young persons today are exposed to so many things. And experiencing poverty is something some of them have dragged into masturbation, and the most part of their life is spent masturbating. Because excessive masturbating, I want to believe, is one of the things that might lead to erectile dysfunction, because that side limits the persons to really begin to have that as a form to be with. As they grow up, like the doctor said, they will now see the woman as maybe a thing not to really be with. Then they go to fall, have sex with another thing, or go to another quarter to have fun instead of being with the wife. So can we correct all this and try to see? That's the point I had knowledge on some of the things we are talking about, because I had training on that during my studies in school, and in connection to human virology, Abuja, on sexuality, on how the youths can really maintain themselves, because the most part of their life is live later, not to live the most part of it. That's what leads to impotence among couples today. You see, a man later in life cannot impregnate a woman because he has ejaculated virtually most part.
Is that possible? Is that possible? So, Dr. Sofa, can you ejaculate your life out to the point?
No, what is there that it may not be, let's say, all, but at the end of the day, the person is like supposed to save his life or his potency to mate with the wife. But excessive masturbation most of the time has a way of making somebody to lose strength later.
Okay. All right, sir.
Life.
Okay.
So all that could be corrected as the youth, I want to believe, are also listening to us.
Yes.
Thank you.
And thank you too. Thank you too. I'll take one last call, and indeed, we might have you come talk to us about what you learned too about human sexuality, especially for the young people listening one of these days. Hello, good evening. You are our last caller. Please, quickly. Hello. Hello.
Yeah, good evening, ma'am.
Good evening. Please go ahead quickly.
Yes, I want to ask, if somebody is taking high blood pressure and taking high blood pressure pill, does it have any effect in man's ability to perform?
Okay. All right. I'm thinking you just joined this program because Dr. Sofa had actually explained that yes,
it does.
There are some drugs, especially BP drugs and diabetic drugs that actually affect not the drugs per se, but the ailment itself, and then sometimes the drugs. All right. So, Doctor, coming back to you now quickly, we have just about some 6 minutes and we have to go. So, the questions that have been asked, we have the person who is asking what's in the place of food. What's the place of food when it comes to erection? And is it possible for you to ejaculate so much that later on in life it will finish?
Okay, for food, we can't overemphasize the importance of eating healthy. Yes, I think that's the most important thing. For food itself, directly affecting one's ability to perform, not in that manner. However, of course, the hypertension, diabetes have indirect relationship with food. However, some things that we can take orally that can affect erection directly, alcohol.
Okay.
Now, I'm saying something that may be controversial. In small amounts, alcohol may even boost this thing. But excessive alcohol, as it begins to increase, depresses and in the long run, also, it causes erectile dysfunction. Yes, so chronic, that's long-term taking of alcohol, and then large amounts of alcohol depress and cause erectile dysfunction. Yes. Then on the issue of whether the testis has been designed to continuously produce sperm cells. Yes, the total number of cells that are active and productive may reduce a little, but all through the life of a man, the testis is still producing, the prostate is still secreting, the seminal vesicles are still secreting.
Okay.
Yes.
Then I just saw a question here. Someone was asking, can something cause, can a lack of congress cause backache amongst men or women? This is from Zachariah John Dam. And of course, I see your text message. Thank you very much for the encouragement, Ibrahim Musa from Rigasa. And Ifoma Imerigini is saying that you just corroborated her thoughts on prostate cancer and inactive sex life for men. All right, she says Charlie Boy, area father, was very active in sex during his youth and old age, but still had prostate cancer. So active sex is not a preventative measure. All right, thank you so much, Ifoma Emerigini.
Yeah.
Coming back to you, Doc. Okay, sorry, Reverend, let the doc answer this question about backache.
Okay.
Can an inactive sex life be responsible for chronic backache?
No, it's not. However, there is a drug, like one of the drugs commonly used, yes, for improving sexual performance can cause severe backache as a side effect. So I don't know if he took that.
Are we talking about clinadopil? What's that thing that you call?
Tadalafil. Yes, one of the side effects.
It can be one of the side
Yes,
effects.
side effects,
Okay.
backache.
Okay.
Yes.
Reverend, you were going to say.
There's a man who was asking about the wife that is not interested in sexual intercourse anymore.
Yes.
I want to appeal to both of them that they don't defraud the other, so that the Bible, one of them would not go wrong, like going into masturbation, which is medically, they don't condemn it outright, but I condemn it because it has effect upon the outcome at a later age. Even young people are experiencing it already because they are involved in masturbation. When it comes to the real thing, they don't even gain erection. It's so bad. So the man and the woman should be persuaded to begin to practice this congress, not to defraud the other. Is very, very important. Yeah.
Dr. Sofa, a final word for our men, especially as it regards their sexual and reproductive health. You want to say something?
Yeah, finally, it's just a word of encouragement. It's don't feel embarrassed, don't feel shy. Come talk with your doctor. There's always a way out.
There's always a way out. I love that. Come and talk to the professional. There's just so much we can do in an hour and a half here. But I'm sure, having listened to Dr. Sofa, you'll realize that there's so many things that we just sit back and allow fear to take over. Go and see a urologist. Ensure that you're seeing someone who knows what he's doing, and talk to them. Like, really, frankly, there's really nothing you want to say anyway that is new to them. They've heard it before. They've been there, done that. So do not think that you're the first person who is coming with a certain kind of problem and be so shy that you don't want to talk about it. I'm so glad that we were able to get you, Dr. Sofa. Honestly, Dr. Paul Dogo, if you're listening, we really appreciate you. Thank you for bringing in this big through Reverend Joe Adejo. Yes, because I know consultants, even for my health program, to get them to come, even our resident doctors, to get them to come is a problem. How much more a consultant? So thank you very much. We appreciate you. God bless you. We pray that God returns to you through in his divine mercy what you have given to us today, because indeed I know you have opened up our eyes to so much. And of course, Reverend Joe Adejo, you know how we feel about you. Thank you so much. God bless you. You're always there for us. Thank you so much. And so until next week, when we hope to come your way, this time around with a gynecologist, I'll hope to have also Pastor Dr. Patience Dodo, who will sit in, and we're going to be talking about female issues come next week. We will be also talking about how to ensure that your sexuality as a single person, you maintain it so that you do not spend your energy in the wrong way. I hope that the man who spoke to us, the other Reverend Alidu, I think you said, if you could reach out to me, I would appreciate that. But until next week, fan your love to flame. Enjoy your marriage, because that is how God meant for it to be. Have a victorious week ahead.